New at 5, Northwest Arkansas leaders have a better grasp on the evolution of the region, and now they're thinking of some changes for the future as well.
Yeah, 5 News reporter Jose Carranza attended NWA Council's annual meeting, shows us what could be changing in the region's health.
At the NWA Council's annual meeting, the region's healthcare took the stage. The group, Trip Umbach, presented their findings that healthcare and healthcare education has grown, giving patients more local options.
The new Northwest Children's is a great example of how children from this area had to go out of the market, but now they can stay in the market, and people from close by are coming into the market for pediatric care.
We estimated the economic impact of the healthcare economy around $2.5 billion. We've grown that to $4.5 billion now, so 80% growth.
People leaving for care once cost the region $950 million per year. It's now been reduced to $250 million. But on their study of the past 5 years, Trip Umbach found a workforce shortage, a need for specialty health care, and a regional need for a level 1 trauma center. This while the state ranks low health-wise and for reimbursement in the country.
For some reason, the United States gives the smallest amount of money to Arkansas of any other state. So the healthcare practitioners like doctors and the healthcare organizations and systems like Washington Regional and Mercy have 30% less money to work with.
So for the future, they've suggested 4 strategies in their Vision 2030 report: a continued expansion of healthcare specialty services and the healthcare workforce. Research and innovation should continue with schools like the University of Arkansas, and to advance health policy reform and value-based payments, focusing more on paying for the quality of care rather than the number of services provided.
I think the big issue is really advocacy and communicating to the federal government and to the state government with a single voice, and strong collaboration between all of the different players.
Umbach says there's good news there. The work is already in motion with players like the Alice Walton School of Medicine, Mercy, Washington Regional, and others involved. In Siloam Springs, covering news where you live, Jose Carranza, 5 News.